Hi, I'm so delighted to meet you in the program of 1 minute, please. If someone has futures of chronic kidney disease, there are 4 drugs which can retard the progression of chronic kidney disease. What are those 4 drugs? One, ACE inhibitor or ARB. When you recommend ACE inhibitor or ARB, which can effectively relax the efferent arterioles, resulting in decreased intraglomerular pressure, resulting in decreased proteinuria, by which it reduces the progression of chronic kidney disease. So, when you recommend ACE inhibitor or ARB, please be mindful that after introduction of ACE inhibitor or ARB, after 1 or 2 weeks, you have to repeat eGFR and potassium. So, normally we expect there is less than 30% reduction of eGFR from the baseline value. If there is more than 30% reduction of eGFR, then probably you have to pause the recommending ACE inhibitor for a while. Then you have to restart. Parallelly, potassium also should be looked for. If potassium level is more than 5, then you have to stop the drug. Then you have to restart at the appropriate time. So, one is ARB and ACE inhibitor, and second one SGLT2 inhibitor. So, primarily SGLT2 inhibitor designed for glycemic control. Then finally, it has been found that it is capable of reducing the reduction of progression of CKD. So, how it is able to execute safety mechanism in reducing the progression of CKD? So, basically, when SGLT inhibitors are administered, the sodium glucose transporters that are present in the proximal tubules are effectively inhibited. So, what happened? There will be more glycosuria, so more sodium excretion in the urine. When more sodium excretion in the urine, there will be more delivery of sodium to the distal tubule. When more delivery to the distal tubule, what happens? There will be abrupt stoppage of tubuloglomerular feedback mechanism, resulting in afferent arteriolar constriction, resulting in decreased intraglomerular hypertension, resulting in decreased proteinuria. So, finally, there will be reduction of the progression of CKD. So, what you have to understand that when you take glomerulus, okay, so naturally when somebody develops chronic kidney disease, especially in diabetes, there will be increased intraglomerular pressure. This increased intraglomerular pressure worsens the chronic kidney disease status. So, at any cost, you have to reduce the intraglomerular pressure. So, to reduce intraglomerular pressure, you have to do 2 things. One, the afferent arterioles that are coming to the glomerulus should be constricted. The efferent arteriole that is going out from the glomerulus should be relaxed. So, this is a pathophysiology. When afferent arterioles are constricted, so what happened? There is decreased glomerular flow, so intraglomerular hypertension comes down. When efferent arterioles are dilated, okay, so what happened? There will be good amount of blood flow from glomerulus to outside. So, what happened? There is a reduction in the intraglomerular pressure. So, that is the pathophysiology. This afferent arteriolar constriction is mediated by SGLT2 inhibitor. Efferent arteriolar dilatation is mediated by AC inhibitor or ARB. So, that is why both are useful in retarding the progression of CKD. Then apart from that, there is something called mineralocorticoid receptor antagonist, that is nothing but finerenone. So, finerenone can be given in CKD with 10 milligram or 20 milligram. So, what they have found that in the pathophysiology of chronic kidney disease, there is activation of mineralocorticoid secretion. So, these mineralocorticoids causes much fibrosis and scarring in the kidneys. So, when you inhibit the mineralocorticoid, so you can prevent the progression of scarring and fibrosis, resulting in improvement in the outcome. So, you can introduce phenyrenone, but only one thing is you have to be cautious about hyperkalemia. If potassium level is more than 4.8, then you should be very mindful about that. Fourth one, GLP-1 receptor agonist like semaglutide. So these four drugs can reduce the progression of CKD. When someone is found to have CKD, you can liberally use these four drugs. One, ACE inhibitor or ARB. Two, SGLT2 inhibitor. Third one, mineralocorticoid receptor antagonist, especially phenyrenone. And fourth one, GLP receptor agonist like semaglutide. Thank you.